Hi, thank you for joining me today. I'm Dr. Kelly Bomer, and we're going to be talking about a procedure called ThermiTight today. We've brought that into our practice, and Dr. Bouzoukis, my partner, is the one specializing in the technique. Hi, Dr. Bouzoukis. Thank you for joining us today.
Oh, my pleasure.
So, could you tell us a little bit more about the ThermiTight and why it's so exciting?
Absolutely. So ThermiTight is an energy-based device that's designed for tightening the neck. And it's an area that a lot of people have issues with as we age. We start to develop laxity in the neck, and it's something that people would like a solution for. And so we brought this technology on about 1.5 years ago, and it's been very successful, and it's very safe, and it's very effective. So we've really been enjoying it. And just briefly, the energy it uses is radio frequency energy. And radio frequency has been used in surgery since 1926 for helping with surgery, helping with dissection of tissues, and also cauterizing. So it's a very safe technology that's been used for almost 90 years. And it was developed and applied specifically for ThermiTight, which is used for the neck. And so it's a really nice treatment.
And so how does this compare to other procedures out that tighten the neck that aren't surgical?
So that's a good question. The biggest change you're going to get for your neck is going to be a face neck lift. But not everyone's ready for that. But that does produce the most dramatic results in terms of tightening, giving a nice angle to the neckline. The downside with a face neck lift is that there's a lot of recovery time, a lot of downtime afterwards, plus there's added expense. So there's been multiple technologies developed to try and tighten the skin that are considered minimally invasive, which is what most of us want nowadays, to have less downtime, get back to work faster, still have good results, but not the expense and the recovery of surgery. Some of the other devices that are currently on the market try and tighten the skin by using different types of energy. Thermage has been around for a while, but it's falling out of favor because it's very painful actually to get it, and the results are a little inconsistent, and Ultherapy is a newer one as well. And those technologies deliver energy through the skin. So there's a limit to how much energy that can be delivered through the skin without risking damaging the skin, because that's the line we're trying to ride. You want to have enough energy to change the skin, tighten it, build collagen, but you don't want to deliver too much energy to burn. And so ThermiTight is really the only technology that actually delivers the energy from the undersurface of the skin. There's a small probe that's inserted through a little needle insertion, and it goes under the skin, and it actually delivers the radio frequency energy from below. So you can safely get higher temperatures, which is what's needed to both melt fat and stimulate collagen while not damaging the epidermis. And so in terms of researching what technology we wanted to bring on, two things that were critical is it has to be safe, number one, and it has to be effective. And we thought that the ThermiTight really had both those qualities to a T. The thing that also makes it very safe in terms of the heat is the thermistor tip of the probe. You can set the exact temperature that it gets heated to. So we know if you want to tighten collagen, you can set it to a certain temperature. If you want it to melt fat, you can increase the temperature. At the same time, we're using a real-time infrared camera that maps the temperature of the skin that we're doing it. So you can see exactly how hot the skin is getting on the outside. So you know that we want to get the skin on the surface heated to between 42 and 45 degrees centigrade, which means that collagen is going to be developed, but it's not in a range high enough to actually cause any injury to the skin. So having the two means of monitoring the temperature, both the probe temperature itself beneath the skin and the temperature of the skin itself measured with an infrared camera, really ensures that we're getting an effective treatment without injuring the skin. And so that's really what separates it. There's also another option that some people are doing in terms of addressing specifically submental fat, and that's Cabella. And Cabella can reduce fat specifically in the submental area, but the downside of that is it doesn't actually do anything to tighten the skin or stimulate collagen, whereas ThermiTight can both melt fat as well as tighten collagen, increase collagen production, which tightens the skin. And so it's really, in my opinion, it's a little superior to some of the other modalities that are considered minimally invasive that are out there on the market today.
That's great. So the difference is this is actually a probe underneath the skin, and we're able to get a little bit hotter without hurting the outside of the skin.
Exactly.
and also melt fat
Yes.
at the same time, depending on what the patient has.
Mm-hmm.
And some of the other procedures out there, they're trying to target all that tightening and fat melting sort of from the outside, which risks the skin on the outside.
Yes, if all the energy is being delivered through, there's a limit to how much energy you can deliver without burning it, which is why it's a great technology for delivering energy from beneath the skin.
And then Cabella, which is an injection procedure,
Mm-hmm.
right, that was recently FDA approved, just targets the melting of fat with the injection of a substance that melts the fat. It takes a little bit of time for that to work and usually involves several injections, but it doesn't address tightening the skin at all.
That's correct.
Okay.
And then for certain patients, if they do have some extra submental fat that they don't like, in addition to the ThermiTight, it's very easy to put in a small cannula through that same insertion point and do a very minimal liposuction. So they can be combined for added reduction of fat.
And so when a little bit of liposuction is added to the procedure, does that add downtime? Does it add,
Not
more recovery?
significantly.
Oh, great.
And you bring up downtime, and that's another nice thing about this procedure. We consider it microinvasive. There is a little cannula that goes under the skin. We have some patients that go back to work the next day. What can be expected is there's definitely swelling that occurs. Because we're introducing heat, the body then responds by swelling. So the neck can be pretty swollen for several days, even up to a week. But we have some patients that go back to work the next day. Some, if they're a little self-conscious, they might wear a scarf. Bruising is another side effect that sometimes occurs. Usually the bruising is pretty minimal. There's also numbness of the neck that is normal that gradually gets better several days to a week or two.
How about activity level? Can people go back to working out right away even though they're swollen, or do they have to kind of hold back on that as well?
We usually have them hold back for several days. They can start being a little bit active. It's not nearly as restrictive as a surgery, but they can start resuming their normal activities and working out within several days for most patients.
Yeah, typically with a face neck lift, the no working out is about 2 weeks.
Yeah,
So this is sounds a lot more liberating.
it is.
So with a facelift, sometimes people will need another facelift, as time goes on. Is a ThermiTight a procedure that can be done again?
For most patients, it's considered a one-time procedure, but as you mentioned with facelift patients, we continue to age. Whether we get a surgery, whether we get filler, whether we get ThermiTight, our body continues to age, skin can then become lax again. So it's not designed to be done in a series. It's usually one time, you get the results. But certain patients, you can definitely do it again a couple years later if they need it. It depends upon their aging, depends upon if they've gained weight, if they lost weight, or if the laxity of skin, but it can definitely be done a second occasion or even a third occasion if necessary. Most of my patients so far, we've had it for about a year and a half, and I think only one patient we've repeated it on. But it's possible down the road more patients will need a secondary procedure. But again, with the minimal downtime, it's not that big a deal for most patients to get it again if they need to.
Great.
And the one thing I want to address is the results. It's not instant. What's happening is collagen is actually being laid down under the skin, and that process for the body to create new collagen and new elastin that really tightens the skin and gives it a little bit more of a youthful look, that takes at least 6 weeks for the body to lay down this whole collagen matrix. So the initial phase, you're going to be swollen and a little bit numb for a week or so, and then it's usually about 6 weeks or even 8 weeks before an appreciable change in terms of the tightening has started to be noticed. And then the improvements continue for 8 months even, that you continue to get more tightening as time goes on.
Great. So it's a little bit of a delayed, improvement that people
Yes.
experience, but the nice trade-off is you don't have that downtime and you can get back to work really quick.
Exactly.
So that's great. And so what's involved for the patients when they decide to go ahead with the procedure? What's involved for them?
So most patients, so it's done here in our procedure room. Most patients elect not to have any sedation, and they just do local anesthetic, which is numbing, like Novocaine that one would get at the dentist office. And so the area of the neck is numbed with the Novocaine. Once it's numbed, the probe then goes in, and it takes about an hour, maybe an hour and 15 minutes for the actual procedure to be done from start to finish. And patients, they don't have to fast. They can have lunch and come in since they're not really getting any sedation. We have a small percentage of patients who are a little nervous around procedures, and there's always the option of a little oral medication to sedate them. But 95% of our patients here, they just come in, they get some numbing in, they get the procedure done. And as I mentioned, it takes about an hour and a half total because there's marking that's involved, and then the numbing takes a little bit, and the procedure itself. And then they go home. We have some patients drive themselves home the same day, And then another thing to be aware of, we do have a little compression dressing just to hold a little pressure on that they go home with, and that just helps minimize the edema and helps it resolve faster. And they tend to wear that for several days. So they wear it for 24 hours initially, and then after that they just wear it at night when they're sleeping for several days to help improve the swelling.
Great, so people can, for the most part, drive home after the procedure if
Yes.
they have elected not to do any kind of sedating medication. And there is a little bit of compression that goes on first for 24 hours and then just wearing the compression dressing at night for a few days after that.
Exactly. And then I'll be showing you a few clips of the actual procedure itself being performed so you can get an idea of what the infrared camera looks like, what it looks like to have the patient actually getting the ThermiProbe kind of placed to kind of tighten the neck. And the patient you'll see is completely awake. There's no anesthetic other than just the local anesthetic, but she's very comfortable during the procedure because she's numb and really doesn't feel anything.
Yeah, so we've really enjoyed having this procedure available for patients who aren't ready for a facelift or is just not something that they want to do. And it's a nice way to get some tightening in the neck and also fat reduction without having to go through the recovery of a surgery.
This is a video clip of a ThermiTight procedure being performed in our procedure room. The patient is awake but completely comfortable because she's been numbed up with local anesthetic. I'm performing the ThermiTight procedure. In the background, you can see the monitor, which gives us information about the temperature of the skin using an infrared camera. This ensures that we get to the appropriate temperature. As you can see in the close-up, the white band represents the area I just completed a pass, which is hotter than the surrounding tissue, so I'm sure that I'm getting the appropriate temperature to affect the result while maintaining a safe parameter. And here I am continuing with the thermi procedure, and the patient's very comfortable. And there's a small skinny probe that I'm slowly advancing underneath the skin as I'm heating it up from the inside. These are a couple of before and after results, and this is about 8 months after, and there's been definitely an improvement. And this patient is about a year after, and there's also a significant improvement in her neckline.
Thank you for joining us today. I hope you're as excited as we are about ThermiTight. We've learned that it's a safe procedure for tightening the neck. The results happen a little bit later, but the great thing is that you don't have to spend time recovering. There's some swelling, but you can go back to work, you can go back to exercise pretty quickly, and it's also very safe. It is something that you have the option for doing it again down the road when some aging creeps back in. And so we're really excited that you joined us today, Dr. Bouzoukis. Thank you so much.
No, it was my pleasure. And just to reinforce, as you mentioned, it is a very safe technology. The extra features really ensure that the chance of causing problems is very minimal. It also works. We have happy patients, which is really a great thing too. And it's fairly unique in terms of how the technology of radiofrequency is applied to skin tightening. So we've had it for about a year and a half, and it's been great, and patients have been happy.
Yeah, we definitely anticipate this being a long-term player in neck rejuvenation, and the fact that it's safe and reliable is something that we're excited to have and to be able to offer to you. So please look us up at Rejuvent.com and also call us to learn more about this procedure. Have a good day.